So now we will get the temperature of the patient. The normal temperature ranges from 36.5 to 37.5. And of course, we also have to check the pulse. The normal pulse ranges from 60 to 100 per minute. And of course, for the breathing, it also ranges from 15 to 20 per minute. Okay, normal. The next thing we have to do, next is we have to check the blood pressure. So the normal blood pressure for a patient ranges from 120 to 80 mmHg. mmHg stands for millimeters per mercury, for mercury. Of course, we are now proceeding to the mental status assessment. So for the number 5, we have to note for the general hygiene of the patient, its facial expression, body posture, the motor activity, and the speech posture. So for the number 6, we have to assess the degree of wakefulness, alertness, from all the full alertness ranging from level 1 down to coma, which is a level 4. So next, we have to perform the Glasgow coma scaling and note the eye opening, the motor response, and the verbal response. So for the number 8, we have to ask the patient questions to assess the time and the place and the person. So sir, what time is it now?
12 p.m.
Where do you know where you are now?
Kayla's house.
What is your name?
Recently Palisades.
Moving on to number 9, we have to assess the memory of the patient. We have to state 3 words and then the patient should repeat immediately after you said those words. And of course, ask the question to the patient for immediate measure or immediate recall. Ask events that occur minutes or few hours ago to measure recent recall. And for the remote memory, we have to ask events in remote part for historical events or questions that can be answered by general population. So sir, you must repeat after me: apple, banana, and milk.
Apple, banana, and milk.
What did you eat for breakfast?
Egg and rice.
Who is the first president of the Philippine Republic?
Emilio Aguinaldo.
Okay. So for the number 10, we have to assess the mood and the appropriateness. Sir, how are you feeling today?
It's okay.
Okay, that is good. Okay, moving on to number 11, we have to assess the intellectual capacity, fund of knowledge, and of course the calculation ability of the patient. Sir, for you, what is mathematics?
Mathematics is a branch of algebra, statistics, calculus, geometry, and trigonometry.
Okay, multiply 10 by 5.
50.
So for the number 12, we have to assess the through content, ask the patient for proverbs to interpret, and of course interpret the situation to assess the patient's judgment. So sir, what can you say about the famous saying, life goes on?
Kung bisan may problema, padayonon lang kung para di ka mabudlayan.
Okay, so paano ba sir if nakakita ka sang cellphone nga na wigit, anong himuon mo?
Ihatag sa lost and found para mabalan sang knockout na dulaan kung iya to or hindi.
Okay. So, next is we have to assess for the language and comprehension. Sir, can you read the title for me?
My Not So Perfect Life, a novel.
Okay. Next for number 14, proceeding to the cranial nerve assessment. Cranial nerve number 1, which is the olfactory. We have to instruct the client to close his eyes and covering one nostril at a time, we will let him smell several objects like soap, toothpaste, and coffee, and for him to identify the object that he is smelling. So first things first, sir, please close your eyes. Okay.
Coffee. Coffee. Soap. Soap.
Okay, and last one.
Toothpaste. Toothpaste.
Okay, good. So for the normal result of the olfactory assessment, that is termed as normosmia. It is a olfactory, it is a normal olfactory kind of sense in which the patient has the ability to smell those objects that are tested to him. And for the normal result of the olfactory assessment is called phantosmia, which is a olfactory hallucination, or the patient have a hard time detecting what object he or she is smelling. Okay, so proceeding to the next cranial nerve is the cranial nerve number 2, which is the optic. We have to assess visual fields by the confrontation test, or we will use the Snellen's chart or the new sprint to measure the visual acuity. Okay, please hold, sir, and please read the letters stated at the Snellen's chart.
E, F, P, T, O, Z, L, P, E, D, P, E, C, F, D.
Okay, thank you. So, for the a normal visual field in an island of vision measuring 90 degrees temporarily to the central fixation. And for abnormal, if there is a unilateral optic disc, non-arithmetic anterior ischemic optic neuropathy, while several potential causes optic neuropathy, some of the common symptoms include pain in the eyes, double vision, flashing lights called loss in color vision, and loss of sight in the other eye. Okay, finally for number 16, proceeding to the cranial nerve number 3, which is the oculomotor, cranial nerve number 4, the cochlear, and then cranial nerve number 6, which is the abducens pupillary light reflex. We will perform it to the patient using the pen light. Observe the pupils for the size in millimeter. Observe for any irregularities, asymmetry. So we will ask the client to look at a distance, and then we are going to shine the light obliquely for approaching laterally into the pupil, and observe, of course, the direct response into the eye and the consensual response into the opposite eye. Sir, please focus looking at the distance. Okay, so that is how we do it. And of course, shine the light laterally so that we could assess the pupils, the size of the pupils properly. So the normal pupil size in adults varies from 2 to 4 mm in diameter in bright light to 4 to 8 mm in dark. So the pupils are both generally equal. So normally in the pupils, light that is directed to one eye produces the pupil constriction in both eyes. So the direct response is the change in the pupil size in the eye to within the light is directed. For example, the light that is shown into the right eye, so the right pupil constricts. Okay, for number 17, we have to assess the extraocular movements to the patient, of course, diagonally and then vertically. So I'm going to perform the 6 cardinal gaze to the patient. Sir, please follow the tip of this pen when I move it vertically and diagonally. For the number 18, we have to assess for the convergence and accommodation. So we will be having the patient to focus on the examiner's finger, of course, as it moves towards the patient's nose. So when we say convergence, it means that the pupils of the eyes joining together and turning inward. So we also have to assess for the constriction with near vision, and of course check for the ptosis for the drooping of the eyelids. So sir, please focus on my finger as it goes towards you. Please just look at it. Okay, good. Okay, moving on to the cranial nerve number 5, which is the trigeminal. We will be assessing for the sensation. So we have to utilize a cotton ball for the light touch and flaunt the object for deep touch. So, sir, please close your eyes. So, I will be touching 3 areas with randomly on your face, and please say the word touch if you feel the sensation.
Touch. Touch. Touch.
Moving on, we have to assess the motor. So we have to instruct the patient to clench his teeth and then palpate the masseter muscles in a mandible angle. So sir, please clench your teeth. Okay, and then palpate. Okay. Okay, for the corneal light reflex, we have to utilize again a cotton ball or a cotton whips strand to the cornea. So we have to touch, and then the patient should blink upon touching into the sides in utilizing the cotton whips. This is the sensation in and inverted by the cranial nerve number 5, ophthalmic and motor blink by the cranial number 7. Okay, good. So for the cranial number 7, which is the facial, we have to inspect the face and note some asymmetrical, including like drooping, sagging, or smoothing of normal facial creases. So we have to ask the client to raise your eyebrows. Sir, please raise your eyebrows and then close your eyes. Okay, please close your eyes tightly and then purse the lips. Draw back to the corners of the mouth in an exaggerated smile. Okay, sir, please do the exaggerated smile. Open your eyes. Open your eyes. Moving on to the 8th cranial nerve, which is the vestibulocochlear. Test grossly the cochlear part by having the client close his eyes and indicate when a ticking watch or the rustling of the fingertips of the examiner is heard as the stimulus is brought closer to the ear. Okay, sir, so you have to identify if you can hear the ticking of my watch. First, let us do that. Okay, covering your ear over here. Do you hear a sound?
Yes.
Okay, to the next.
Yes.
Okay, proceeding to the rustling of my fingers. Say yes if you can hear a sound.
Yes. Yes.
Okay. Okay, next for vestibular or balance, we have to perform Romberg's test into the patient. So, sir, please stand. Okay, hands forward, and then close your eyes. Okay, stay still. Okay, good. For the cranial nerve number 9, or the glossopharyngeal, we have to perform the gag reflex test. So by touching the pharynx of the client with tongue depressor on both the left and afterwards on the right side, observing, of course, the normal gag or the cough. So the patient have to be very cooperative. So, sir, as I insert this one, so you have to cooperate by saying ah. So please open your mouth. Open your mouth. Tongues out a little bit, please, and say ah.
Ah.
Isa pa.
Ah.
Okay, so now, sir, I will be holding the throat area and you have to swallow the moment I tell you to do so. Okay, please swallow. Come again. Okay. Moving on to the cranial nerve number 11, which is the spinal accessory, we have to ask the patient to shrug his shoulders, and this time we will be checking for the resistance. Okay, sir, please shrug. Okay, come again. Okay, into the face. So when I hold your face over here, you have to move it to the side. Okay. Next, for the cranial nerve number 12, which is the hypoglossal, we have to protrude the tongue. So ask the client to protrude the tongue, of course, and protrude relatively straight, and minimal degrees of deviation affecting only the tip are insignificant. So, sir, please tongues out, sir.